Welcome to Season 2 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Joshua Sharfstein, Vice Dean for Public Health Practice and Community Engagement, and a former Secretary of Maryland's Health Department. Our goal is to bring scientific evidence and experience to the public health news of the day through informative interviews with scientists, community leaders, policy experts, public health officials, clinicians, and more. If you have ideas or questions for us to cover, please email us at publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Today, I speak with Roy Steiner, Senior Vice President for Food Initiatives at the Rockefeller Foundation, and Paula Daniels, the co-founder of the Center for Good Food Purchasing. Our topic is what can be done about the U.S. food system, its failures exposed by the pandemic. The Rockefeller Foundation recently released a comprehensive report on this topic called Reset the Table, which you can find on the Foundation's website. Let's listen. Roy and Paula, thank you so much for joining me on the podcast. I've just finished this terrific report from the Rockefeller Foundation called Reset the Table, Meeting the Moment to Transform the U.S. Food System. This is a moment with COVID-19 where people are realizing some very serious weaknesses in our food supply. And Roy, talk to us about what the pandemic has revealed.
Sure. The pandemic has revealed a lot of underlying issues that are already there, but it has exacerbated them. And for example, right now we have 14 million children who are not being fed at a level that they need to be fed. I think the number of families that are food insecure has doubled or even tripled. So that's one huge issue. The other...
So people are recognizing that hunger is now a part of the American landscape.
Absolutely. And to the extent that it was at the time of the Depression, right? So we're really at a historical high in terms of food insecurity. I think that the second thing is just how critical and how inequitable our food system is. And our health system is. It's very connected. 94% of people who are hospitalized are really suffering from underlying chronic conditions, primarily age and diet related. And yet the people who have these poor diets are disproportionately people coming from vulnerable communities. So if you are a Black or Latino in the United States, you are 2 to 3 times more susceptible to the worst effects of COVID-19. These are things that, as a society, we can't continue to accept.
And so you've got hunger, you've got the fact that poor nutrition puts people at risk for serious illness and death. What about what we're learning about the actual people who work in the food system?
Yes. I mean, I think we've all heard about the meat packers, but it's not just those particular organizations. All through the food system, food workers tend to be the most poorly paid, the most poorly compensated, with benefits that really don't allow them to live at standards we all expect. And yet they're the essential workers.
Not enough food for some people, poor access to nutritious food for many people, and danger for food workers. The question I want to turn to Paula for is, what are the underlying problems of the food system that are now manifesting themselves in these symptoms?
There are a couple of major design flaws in our food system that could really use a 21st century upgrade. One is the inequitable distribution of food in our system, and the other is what we measure and what we consider as measuring what matters, really. So in terms of distribution, we produce more calories than the world needs. We produce enough calories for 2,700 calories per person in the world. Yet, the average woman needs 2,000, the average man needs 2,500. So we produce more calories. It's just obviously not being equitably distributed. So there's a major design flaw in that regard. And then we also are not really measuring what the true cost of food is. So we're not measuring. We're looking at food as a calorie system and that is delivered inexpensively, but we don't look at the actual impacts of that production system on the environment or on people. And if we were to take a classic example, but if we look at an example of an apple and a hamburger, they cost about the same. An apple costs per pound about the same as ground beef, but the apple is true cost. The apple bears the cost of its value. It's the production cost as well as the cost to the farmer and the farm worker to pay them, and then its value in nutrition. Yet the hamburger, which takes much more and produces much more impact, has been subsidized along the way. So we have that problem, and those problems in design were really revealed in the inequities and the issues that Roy just described. Because what we've been seeing in the food system is that it's really geared toward those economies of economic scale, but it doesn't value these other attributes of nutrition and health and fair labor and support for local farming economies, which is where the distributional piece comes in. All right. So
when you have the stress of the pandemic, these different flaws are magnified.
Completely magnified. I would say it's like the food system is on a crumbled infrastructure similar to the San Andreas Fault, and then everything just flew wide open, and the fissures were revealed. So every problem was starkly revealed. I mean, we saw the lines at the food banks, while at the same time, all that food was going wasted from farmers who couldn't send the food to the right place. And that's what I mean by a distributional problem.
Right.
The supply chains for distribution were geared along these very elaborate, intermediated supply chains, but weren't as closely related to need or to supporting the local farming economy, those areas that were near where the need was, so they weren't as geared toward that. So those are the sorts of distributional problems that I'm mentioning.
Now, I know there's been a lot of effort on short-term solutions, and this report covers some short-term solutions, but also asks a really important question of whether this is an opportunity to reform some of those underlying issues that you're talking about. I want to turn first to the short-term solutions. We have a lot of hungry children, families in this country. What are the short-term things that need to be done? Maybe, Roy, if you could speak to some of those.
Sure. And, Josh, one of the things we did is we brought together leaders in the sector over a course of 8 policy roundtables to really look at those questions, both the short term and the long term. And out of that really came a recommendation for 3 fundamental shifts. The first is we need to have a much more integrated nutrition security system. So, for example, I think we need a universal school lunch program. We recognize how critical schools are for getting proper nutrition to the next generation of Americans. I think the benefit program is so fragmented. We need to enable SNAP and WIC and all these other programs to work more effectively together. And then thirdly, in that first, as part of that integration, we have to think of food as medicine. And there's some really, I think many of your listeners know about the Project's prescription programs, et cetera, but those could be dramatically increased. In fact, if we actually had that, I don't think COVID would have the same impact that it had. If we really had a healthy population, we would have had a much lower hospitalization and mortality.
So just sticking with that first shift that you're talking about, some of those action items could be done relatively quickly.
Yes.
You could be giving people more access to food benefits so they could get more food, for example. And others, you're thinking about some longer term policy changes that would alter the way that food gets distributed.
Exactly.
So, Paula?
I would just add to that, though, too, that one of the recommendations of the report, and I really want to compliment Rockefeller in stepping up and pulling this together in such a short amount of time with a broad amount of input. It's really important. But one of them was to invest in private funding, reimbursing school districts and recognizing their role as anchor institutions and reimbursing them for their emergency role in food. And that's a dramatic problem. The school districts are losing millions and millions of dollars because they stepped up to provide this emergency food. And in some instances, they have not been reimbursed. I think LAUSD alone has lost $30 million. And he was not reimbursing them.
Yeah, and I think it's really revealed, the pandemic has really revealed the absolutely vital role that schools have played. And
That's
if
right.
you had said to me, who's going to come to the rescue of all these children who are going hungry, I don't think anybody has beaten out the school systems in terms of what they've contributed in many places.
They play a really key role as anchor institutions and as in serving their local communities.
Great. So maybe, Roy, what's a second major shift that needs to happen?
Yeah. So the second one ties in with what Paula was talking about in terms of supply chains. We need really a reinvigorated regional systems. We now have highly centralized, consolidated food system where only a few companies control so much of the supply chain, and we're moving food very long distances. Well, that's highly efficient, but it's not resilient. And it's actually not healthy for local and regional food economies. And we need a rebalancing of how we've built and developed those food chains.
So, Paula, maybe could you talk about what that looks like in practice?
Mm-hmm. Well, one thing the report highlights, and this is really true, there's been a lot of effort toward this for some time, is the need toward having a good balance of and more strength in a regionalized food system. So you have a mix of local, regional, state, and global, all working together to support a regional food economy, but more now than we have had. So in many places, the regional food economy is about the local food system is like 5 to 10%. That's the average in the United States. And in California, they produce the world's, definitely the country's produce, only 5 to 10% of that is local. So those are long supply chains, right, where there's a lot of intermediaries along the way. If instead you build more local supply chains where you have mission-driven intermediaries, that some are called food hubs, where they're dedicated to sourcing from the local farming economy and also supporting equity along that supply chain, and then dedicated to supporting healthy food access, distributing to schools, and in other places, senior meals, other places where the need is great.
What would be a model of that? Where would you look to say this can be done in the United States?
There's a good example, actually, in the Northeast. There's a food hub called the Common Market that was started in Philadelphia, and they now have 4 locations. During the early days of COVID, when it hit New York, they were immediately able to pivot from serving the communities they had been before to pivot toward getting more food to the school districts, more produce to the school districts. It was already set up, and they were able to do even more of that. So they increased their amount. That didn't happen in other areas where you don't have the food hubs. It was harder for them to connect those dots.
So maybe a little less efficient, but more resilient, and really demonstrating that in the pandemic.
I think it's as efficient as the other system. What's different is how it's compensated. So right now, the Common Market is a nonprofit entity that relies on grant funds and some earned revenue. So I think this is a place for government to step up and realize that that's a really important function that needs to be supported in different ways.
Now, can purchasers play a role in facilitating the creation of regional food systems?
Yeah, if we go back to school districts are largely the biggest food service provider in any region. In Los Angeles, the LA Unified School District is the largest food service provider in LA and second largest in the state. So they had a $150 million a year food budget. That statistic holds true over every region. So with their purchasing power, they can direct their purchases toward food that you could also call it more true costed, food that is more respectful of the environment, more respectful of fair wages across the supply chain, and deliberately sourced from small and mid-sized farms in the local regional food economy. And then that can spur market demand. They can support the supply chain rising up to meet that market demand, and have intermediaries like the Common Market be involved.
Who would you look to join school districts in purchasing that way?
I think you could definitely have all the major institutions in any region participate in this. Hospitals, jails. In our program, we actually have hospitals, jails, school districts, universities, all the major food service providers. Along with the ones I've mentioned, there could be those private companies who might be willing to step up and also make those same commitments, such as restaurants and other large-scale restaurants and other locations, entertainment venues.
Got it.
I think the best place to start is school districts, hospitals, and other publicly funded institutions that serve the public.
Great. Roy, let's go to shift number 3.
Sure. So the third one was, how do we build more equitable prosperity throughout the supply chain? As you probably know, most farmers really can't cover their living expenses with the revenue from their farm. We've really squeezed farmers, we've squeezed workers all along the chain. And so prosperity isn't shared. And we need to do that, I think, much more explicitly.
And do you think one of the consequences of that is the higher risk for COVID that we're seeing in some of the workers?
Exactly. OSHA must set and enforce better mandatory guidelines to keep workers and the food supply safe, and that's not happening. So some of the other things, that would create more equity is better credit, loan serving, debt relief for actually the people who are growing our food, the farmers and the ranchers. Right now, they bear the brunt. They take so much of the risk. And so we need to rebalance that. It's not fair.
Now, you've talked, Paul, a little bit about getting the right price for foods. Does that play a role in making the supply chain more equitable?
I think that there's a really important time for incentives to support more equitable and environmentally sustainable food. This is already happening in some areas. Michigan, New York, Oregon, and New Mexico all created incentive programs for school districts in their purchasing to purchase more local food. Those incentive programs could be emulated in other places, but they could also be expanded because local is only one part of the equation. There's local and there's environmentally sustainable and there's fair wages, all of which need to be incorporated into the price of food, particularly at school districts, which currently are paid through the school lunch program. And their average reimbursement rate is $3 a meal. That tends to lend itself toward efficiencies of scale and commoditized food. So they're able to do it with their purchasing power, with high volume, long-term purchasing contracts to make the changes that we've talked about. And many of them are, but with incentives directed their way, they could do even more. And that isn't needed in order to make the supply chains, the whole food chain from farm to fork, more robust. It currently has a lot of weaknesses in it, which were revealed during COVID. So to make it more robust and to strengthen it, we do need to direct our money where things matter.
And Josh, the vast majority of subsidies currently in the system go to really just 4 crops, right? Corn, wheat, soybean, cotton, and indirectly sugar, although that's because we keep the price at a certain level. So we're actually subsidizing high fructose corn syrup. And very little goes to all the healthy food that we know is needed for a healthy diet. Like it really does not make any sense in terms of thinking about the long-term health of the country. We have a system that was designed 50 years ago that is not delivering the value we need.
So if people think like, if we're going to try to build in these different costs and everything's going to be much more expensive, nobody will be able to afford food. They're not really understanding that we're spending a lot of money now that could be redirected and certain foods could actually become less expensive. Would that be fair?
Well, I think that's absolutely right, because right now we're spending an awful lot on public health. And the issues that Roy raised, we're subsidizing high fructose corn syrup, which is creating a public health problem. So if we redirect those funds, if we're able to level things out and redirect those funds, we'll have a healthier society, we'll have a healthier economy, we'll have a healthier workforce who are able to pay the laborers more. They're getting sub-minimum wages right now. They are on food stamps. They cannot afford the food that they grow. So if we were able to pay them more and they can afford the better food, then we'd be leveling things out in a way that makes a huge difference.
Yeah. And just, right now, one diet-related disease, type 2 diabetes, costs U.S. At over $300 billion. But it's huge. If you think about how much are we spending in terms of supporting farmers with research, $1 to $2 billion. If we could just take even 10% of what we're spending on diabetes and put it on producing healthy, more sustainable food, it would make such a huge difference and be very economical.
So the pandemic has shined a light on these really serious challenges in the food system. They've gotten worse. We're seeing the human effects of that all over the country. The conversation is shifting around what we need to do to have not just less expensive foods at the grocery store, but better access to the right foods for everyone. How do you think this plays out? How do you think this conversation, this report, moves from a discussion among many experts in the field and people on the front lines to kind of the halls of power and the chance to change things? What's that path look like?
Well, I think in some ways, a lot of it's already happening. I mean, as you mentioned, everybody's talking about food in a way that they really have not talked about in, I would say, decades. Being sequestered at home, and having to cook all your own food, it's top of mind. And just seeing the level of hunger, I think that the conversation has changed. The challenge, of course, is how do you then transfer that into specific policies, and that's going to take, I think, a lot of people and a lot of different groups that are out there working together. It's not just the food and hunger advocacy groups. It has to be the education community. It has to be the health community. It has to be the private sector. There's a whole bunch of private sector companies that recognize healthy food is the future, and they're making. We need to encourage that. So, and investors, et cetera. So we need all the various sectors to be working together.
Great.
And now, Paula?
Okay. Well, I think that the work is happening, as Roy pointed out, but I think it can also happen more immediately and more urgently and with more intentionality at a local level. So right now, mayors could take charge of their local food system, and they could implement a number of the ideas that are recommended in this report next week if they put their intention to it. In particular, they could start setting the purchasing targets, the aggregate purchasing targets that would start making a difference in their local and regional food economy. And they could look at these other ideas and start making those changes. So the ideas in the report can be implemented at different scales and immediately could be implemented at the local level.
Great. Well, that was a fantastic last word for a great conversation. I really appreciate both of you joining me today.
Thanks so much, Josh.
Thank you so much.
Public Health on Call is produced by Joshua Sharfstein, Lindsay Smith-Rogers, Stephanie Desmond, and Lamari Morales. Audio production by Spencer Greer, Niall Owen McCusker, Cian Oates, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Thank you for listening.